Hey, what's up, everybody? This is Dr. Brandon, Maximize Living Chiropractor here in Lewis Center, Ohio, specializing in spinal correction and lifestyle wellness, so we can get you physically and spiritually whole. Today, what I want to do is I want to touch base on a question that I get from a lot of patients. What exactly is happening during the adjustment process? I try to do a really good job of explaining this. I think the issue is that maybe you've gone to a chiropractor in the past. They do a completely different thing. You come into our office, we do a completely different thing. You go to another chiropractor, we do a completely different thing. I think that's the cool thing about Maximize Living is we're trying to keep everything uniform, so that way we can really, make sure that people understand what's happening during the adjustment. So I want to walk you through, some of the physiology that is happening during an adjustment and why it is that. One, it doesn't take a whole lot of time. It doesn't take a whole lot of you doing anything besides at home. And what exactly the instruments and the adjustment does. And so I want to walk you through the beginning stages. So that when you first walk into our clinic, we're going to start with the neck traction. So and the wobble. It's impossible for you to be able to get the changes short term and long term without doing those exercises before you get adjusted, because think of a piece of steel that's bent and crooked. You can't bend that piece of steel back without heating it first. And so a lot of times you'll go into a chiropractic clinic, you'll lay down the table, you get adjusted, you get really sore, but there's no structural rehabilitation going on there. And so we need to make sure that we warm the spine up before we get adjusted. The second thing that we do is we have you lay face down on the table, really not out of gravity, but just in a neutral spinal position. And laying face down is the most relaxed position for your spine to be in. So the stressors of the day can allow your spine to relax, and those tissues can relax. You'll feel me actually doing a leg check. So some people walk in and their legs are 1 to 2 inches long, some not. People ask me, do I have always have a short leg? Well, actually, everybody does have about 1/8 of an inch short leg, and that's just normal as far as an adaptation process for the body. But you're not supposed to have like 1 inch to 2 inch short leg. That tells us that you have neurological tension on the spinal cord itself, which causes those legs to pull short. So anything can cause neurological tension. The food you eat, the thoughts you think, and just physical trauma to the actual spine itself from bad posture. And so what I do is I do these what we call neurological checks. So I'm going up and down the spine, and I'm putting pressure in certain areas of your spine that directly attach to the spinal cord itself. So there are certain bones that attach to the actual spinal cord. There are about 9 of them. So really what I'm doing is I'm just putting pressure tests into the body, and then if it balances those legs, that tells me exactly where I need to go to adjust the spine. There's no guessing there. I'm not just trying to adjust every single bone in the body to get things to move, but I'm really trying to neurologically be super scientific in what we're doing. And once I do 3 adjustments there, what I do is we may need to actually adjust the spine with our hands. If someone needs correction or there's something going on structurally in the spine, we'll actually adjust the spine based on your x-rays. And so that's why we have your x-rays pulled up. That's why it's very important for you to have your key card and pulled up, because we really don't know really exactly what we're doing as far as correction goes unless you have the x-ray, because you have no destination of which way you want to be. Without a picture of your spine, we don't know where you're at and where we can go. Every spine's a little bit different, so need to have those up. After we adjust you, maybe with our hands, we do drops, we do manual adjustments to help put those arcs and curves back into the spine. We use what we call the arthrostem, and that's the gun. And so what I do is I have you sit or lay down, and we're actually putting those curves back into the spine. That instrument fires at 6 impulses a second, which is so fast that your muscles can't guard me. And so we're actually moving the bones in that particular adjustment. Even though you can't feel it and you can't feel a pop, the bones are actually reshifting. Now, what happens if we let you go out the door in your daily life on your cell phones all day? Kids are at iPads now, and we're just doing life in a world that's completely different than what it was 1,000 years ago. We have to do some structural rehabilitation and home exercises post adjustment to be able to get that spine to hold. Otherwise, it's just not going to hold. And if you can show me another way that it's going to hold, then I would be open to that. But the fact of the matter is that, you know, the Pettibon Institute and Clear Institute and CBP and Maximize Living, we're really the only types of spinal correction systems that can actually get the spine to hold and for those curves to stay in there, so that way you don't keep getting subluxated and for those spines to shift back. So that's where we fit you for your weights, and those weights are actually what's going to take the spine from this position to this position and keep it there. And the vibration helps to actually fatigue and stimulate those muscle spindles, so that way the muscles can hold that spine and the ligaments in that position, so we don't go back out of alignment. And so we have you do that system 3 times a week, usually in the beginning, because there's no way that we're going to make, one, a neurological change and therefore a structural change without seeing that person very intensely. Think about this. If you have braces on your teeth and your teeth are crooked, and you go to your orthodontist and every week you get your braces taken off and you don't come back and get your braces put on for another month, your teeth will never change. And that's, you know, pretty typical for a chiropractic clinic. Oh, well, you feel good today, everything looks good, your insurance will cover 12 visits, so let's have you come back when you're in pain, when your insurance will cover it, and we'll check you again. But that's just this cyclical system of just out of pain, in pain, out of pain, in pain, and that adds up later on down the road, whether or not you believe that or not financially. So we want to make sure that we're consistent and the spine does rest on a rhythm, and we put you in that rhythm. The home exercises at home are there to keep your spine stable. Just like if you're flossing and brushing your teeth, there's no difference between your spine and your teeth. I would actually argue that your teeth are way less of a priority than your spine would be, because your teeth don't house your central nervous system and send vital life everywhere. So I hope this video helps you to better understand why it is that Dr. Mary, myself, and my wife, Dr. Sam, are adjusting you the way that we're adjusting you, with the specificity at which we're doing it. And so if you have any questions, just go to our Facebook page, post your comments. You can go to revivechiro.com or revivechiro.life and to listen to our podcast and our past radio shows. Until next week, have a blessed day. Talk to you soon.